Well, good afternoon, Rotarians. I'm pleased to introduce today's presentation on the Alzheimer's Association of Michigan. Today we have two guests with us, Susan Evans and Jean Barnas. Susan is a program coordinator with the Alzheimer's Association Michigan chapter. She's responsible for the development, coordination, implementation, and evaluation of programs and services in the northern and west Michigan areas. Susan is a Michigan native. She returned here last year after living in Florida for 30 years, where she raised a family and worked for several healthcare organizations. Susan earned a bachelor's in gerontology and a master's in adult learning from the University of South Florida, and now resides in Mason County. Jean Barnas has been with the Alzheimer's Association since 2001, working in the care and support area in a variety of roles. Currently, she is the Program Services Director. Jean has a Bachelor of Science in Family Community Services and a Master of Arts in Gerontology and Counseling. She's worked in multiple capacities, serving older adults and their families as a counselor, recreation therapist, and family and resident life director. In September 2006, Jean fundraised nearly $30,000 for the Alzheimer's Association as she joined the Ascent for Alzheimer's World Team climbing Mount Kilimanjaro in Africa. Welcome, Susan and Jean. So
Thank
Susan,
you.
You bet. So just to get started, give us a little background, if you would, on Alzheimer's disease and try to differentiate it from other forms of dementia.
Yeah, thank you. So Alzheimer's itself is a specific disease. It is just one type of dementia, and dementia is the loss of memory, reasoning, or other thinking. So there are many different types of dementia. Alzheimer's is just the most common. And you may have heard of other types like Lewy body dementia. I know that probably got a lot of attention with Robin Williams finding out that he actually had Lewy body dementia, but also vascular dementia, frontotemporal dementia, and there are many other lesser known dementias. But Alzheimer's is a degenerative brain disease. It's characterized by brain cell damage, brain cell loss. It is a progressive brain disease. It is fatal. There is no cure. There is no way to prevent it. There is no way to reverse damage. And until just recently, there was no way to slow the progression. And Jean is going to talk about that a little later.
So talk about the Alzheimer's Association, please. Who do you serve? What services and resources do you provide?
Yeah, thank you. So we are the Alzheimer's Association Michigan chapter. We serve the entire state of Michigan. And I'd say most importantly, we provide care and support to individuals with dementia and their caregivers. So what does that mean, care and support? So that means we offer education programs. We have volunteer-led education programs that are mainly for caregivers on topics like understanding dementia-related behavior. And we even have some wellness topics that we can speak to groups as kind of an employee wellness presentation. But we also have volunteer-led support groups. And in terms of care and support, our 24/7 helpline really fills that gap, being there obviously 24 hours a day, 7 days a week, even during pandemics. It's always open. And that number is the 800-272-3900. And when you call, you can get answers to questions. We can email you. We can mail you hard copies in the mail. We can help you find providers in your area. You can reach a master's level clinician. And this is really a nice service through the helpline. So that person can work with you individually to support you in your journey and what your challenges are that you're facing. And we also have a social engagement program called Community Connect. So that is a great way for people with dementia and their caregivers to stay socially engaged. And that can be a challenge because of unpredictable social behaviors. Some people really pull back and shy away from that. And so this is a great program. Those events are still virtual right now, but even when we go back to in-person social engagement events, we're going to keep some things virtual because it's a really nice way to keep a person with dementia and their caregiver engaged when they can't get out. So we plan on keeping some of that virtual. And those events themselves are the result of partnerships we have with organizations like the Detroit Institute of Arts, the Detroit Symphony Orchestra, the Detroit Zoo, Henry Ford Museum. And those are just really nice offerings for those individuals. And also, in terms of what we do, I just want to mention that, and this is something that I didn't know until I joined the Alzheimer's Association, was that we're the largest non-governmental nonprofit funder of Alzheimer's and dementia research in the world. So only next to the US government and the Chinese government. But Jean's going to talk about that as well. But that kind of sums it up.
Great. Well, it sounds like a lot of very personal interaction, some of the social outings and events. But, with COVID, things changed quite a bit. Can you talk a little bit about how COVID impacted your services and your service delivery?
Yeah, well, we were thankfully able to pivot. There's that buzzword from the pandemic, right? Pivoted to virtual. And in the case of a lot of older adults that we serve, we realized that we had to stop calling it virtual because that was very scary to people. So there are a lot of individuals in Michigan, especially rural areas, who may not have computers, may not even have internet service. So we also, refer to it as telephone programs because even with a Zoom, that's available by phone. So we were able to provide those virtual or telephone education programs, support groups, and it really kept us accessible to those who were not able to get out. And our 24/7 helpline stayed active the whole time. So it was something different. It was a little scary sometimes. I remember one particular group that we had almost 100 people on the phone at the same time. And they all knew each other and hadn't had much of a chance to connect. And so it was a lot of, oh, hi, oh, hi, oh, hi, how have you been? How have you been? It was a little bit crazy, but it was great to be able to still connect with the people that we serve. And we learned a lot through that. And when you think about what are the things that we all learned during COVID that we want to keep, we definitely want to keep a virtual presence. And when we think about those wintry days here in Michigan, it'd be sure nice for caregivers to have that option to join programs virtually or just by phone instead of having to navigate the icy roads.
So do you have an office, a physical location? Where would that be?
Wow, I don't remember. Oh, yes, that's right. We do. We've been working remotely from home for so long. We always almost forgot. Our headquarters are in Southfield, and we do have offices throughout the state. My office, in fact, is in Norton Shores. I hope it's still there, right across from Tanglewood. And it's a little office tucked back in there, right across the street. But we are always available with the helpline. And you can also email us at our helpline. And we have helpline staff specific to the Michigan chapter. So that's helplinegmc@alz.org. And at that website, the alz.org, we also have a chat option. So if you go to that website, alz.org, and I've laughed about this the last month or so, nobody told me that they dropped the www dot. When you go to websites, you don't have to type that in anymore. Nobody told me. So,
Only
our
the
website is
Z generation is aware of that, I'm afraid. So, yeah.
there you go. That's where I learned it from my kids. So alz.org. That chat is available 7 a.m. to 9 p.m., 7 days a week, which is, again, a nice option.
Great. All right, so talk a little bit about where things are going with treatment of Alzheimer's. Research, you mentioned research. Maybe you or Jean could talk to us about that.
Jean, I'm going to let you
And
share.
Sure.
what's the role of the
Yeah,
Alzheimer's Association in research?
sure. And again, thanks for having us. We're both really excited to be here. So, the Alzheimer's Association, we're driven by our mission to lead the way to end Alzheimer's and other dementia. And we do this by accelerating global research and also driving risk reduction and early detection. And as Susan just talked about, maximizing our quality care and support. And I'm very, very proud to share that the Alzheimer's Association, as Susan mentioned, it's the largest non-funder of Alzheimer's research on the planet. And again, we have the highest impact worldwide, just behind the Chinese and US governments. And in fact, right now, $235 million is invested in more than 650 projects in 39 countries. And so we really, again, it's global. We span 6 continents with all of our different research projects. We're in every continent except Antarctica, but maybe someday we'll be there too. And at any given moment, research is happening, learning's happening, and we cross industries, and we're really the ones uniting the efforts. Really, it's because we all share the same goal, which of course is to end Alzheimer's disease and help people as they're living with it right now. So discovery is also happening, and we're just really proud that the Alzheimer's Association has played a vital role in every significant development in research.
So what's in the pipeline?
You couldn't have asked a better question with this timing. On June 7th, the very first treatment for Alzheimer's was passed. And on behalf of those impacted by Alzheimer's, the Alzheimer's Association welcomes and we celebrate the Food and Drug Administration's accelerated approval of this drug. It's called aducanumab, or the brand name is called Aduhelm. And again, this was just a couple of weeks ago. It's historic news. Again, it's the first treatment approved for Alzheimer's disease since 2003, and the very first ever to address underlying biology of Alzheimer's. The other medications approved or they're approved for symptom treatment. So this Aduhelm, it's very pivotal. It's not a cure, but it's really a turning point in the treatment and research of Alzheimer's, and we're really hoping it's just the beginning of many more treatment options. And with other disease entities like cancer, history has shown that approvals of the first drug in a new category, it invigorates the field, it increases investments in new treatments, and generates greater innovation. And already since June 7th, there are 2 more potential treatments in the pipeline in phase 3. So it's already happening. So in a nutshell, Aduhelm, it's a new type of Alzheimer's treatment. It addresses the disease in a way that's never been done before compared with other currently approved drugs. And really for many people, the approval of this drug could mean more time for them, more time for them to actively participate in their daily life, to have a sustained independence in their life, to hold on to memories longer, be with their family members longer. So we're really thrilled that this will lead to some early diagnosed individuals that will have access to better care and treatment options. And really, we want to help them understand the risks and benefits, but it gives them a chance and a choice to potentially buy more time until better treatments, which will be coming down the pipeline, can get approved. And if anyone is interested in this brand new treatment, we really encourage folks to go ahead and talk to their physician or healthcare provider. So it's really an exciting time in Alzheimer's research.
Yeah, it's very exciting. It was an op-ed in the Wall Street Journal today about the drug and about that approval. Went into a little detail around some of the controversy because some of the studies didn't show it to be that effective, but the studies weren't well constructed, and more recent studies have shown it significantly delays progression and attacks the plaques and tangles that are part of the anatomy of Alzheimer's disease. You mentioned that early treatment is important because as of today, there's nothing that reverses the deterioration, but can slow advance. So what are some ways to be alert to early signs of Alzheimer's and get people diagnosed early?
Yeah, that's a really good question too. And to your point, The accelerated approval from the FDA means that they're going to continuously look at the individuals that are receiving the treatment to look at the benefits from it. So that's one reason why it did get approved. And also it does, like you mentioned, looks at the anatomy, and it helps with the plaques, which is a buildup of the brain that causes cognitive decline. But there's on the website, like Susan mentioned, at alz.org, right there's 10 warning signs that we always encourage individuals to go and check out. And I really like this piece because when we are talking with the public and they do see, these 10 warning signs, immediately they think, oh my gosh, I have all of these. But what is important is that you're looking at your baseline and what is normal age-related changes, which everybody goes through, versus what are some things on this list of 10 warning signs, like, of course, kind of the top one that people discuss is forgetfulness. It might be making, not very good decisions. That is another one. Their language skills start to become diminished. So it's really important to take a peek at that list. If you have any concerns about yourself or somebody else, again, reach out to the healthcare professional, because it could be a myriad of things, not just, dementia.
Great. Well, thank you. So what about clinical trials? People are interested in being enrolled. How does that happen?
Yeah. Really, we're hoping, of course, with Aduhelm being approved, there's clinical trials for medications. We're also hoping to help people here and now with the disease. So improving their quality of life, because it's a long disease process. The average person has it for 8 years. However, you can have it up to 20 years. And so that's a very long time to slowly decline and progress in an illness. And so really some ways for improving the quality of life, there's also treatments that are helping that. Some people who are living with Alzheimer's or another dementia, they may have symptoms like depression or agitation or anxiety, or they might have sleep disturbances. And researchers are also working on ways to minimize those type of symptoms too. So those types of things, really can affect your quality of life. And if we can minimize anxiety, agitation, depression, sleep disturbances, it's not only going to help the person who's diagnosed, it will thereby hopefully also improve the quality of life for their care partner or their caregiver. My mom had Alzheimer's for over 10 years, and I can say that when she felt more at peace and she slept well, guess what? So did my dad. So it's really a family disease, and we're hoping to meet people where they are and help with quality of life too. You mentioned it's sort of a two-part question. If you don't mind, I'll talk a little bit about another real easy way to get involved in clinical trials. We try to make it as easy as possible, but the Alzheimer's Association has what's called Trial Match, and it's a service that provides customized lists of clinical studies that is based on information that you provide, that you can do over the phone with that helpline that Susan mentioned, or through alz.org. You can go and find Trial Match on our website, and you provide this information. It's free, it's easy to use, and it allows you to see which studies you're a good fit for you or a family member. You can search for studies or sign up for study updates. And once you are matched, you then can decide if you want to move forward and pursue the opportunity. So they'll let you know what you match for. But for people living with dementia and those personally affected by it, participating in research, it's really a great way to make a difference, to take action. And, as we like to say, don't just hope for a cure, but help us find one. We're always looking for research study participants. I mentioned the association alone has over 650. And we also need healthy individuals as well who have healthy brains. So, if you are interested, go to the website, alz.org, and type in Trial Match.
Great. Thanks so much. So our time is short. Any final comments, Susan or Jean?
I have one. I would be remiss talking about research if I didn't let everybody know about a really cool tool that we have. It's an application or an app that's called Science Hub. and it's free and available, wherever you get your app. So if you wanted to learn more about what's happening in dementia research around the world, really consider downloading the Alzheimer's Association Science Hub app. And at any given moment, you can have research right at your fingertips.
Great. Thanks, Jean. Susan, anything?
Oh, thank you.
Great. Well, thank you both for a very informative talk and discussion about a very important topic. With that, I will return it to you, Mr. President.